Cushing syndrome happens when the body is exposed to excess cortisol for a prolonged period of time. Cortisol is produced by the adrenal glands and regulated by ACH from the pituitary. When ACTH is overproduced, often from a pituitary tumor, or when a patient takes long-term corticosteroids, cortisol levels remain elevated. And when cortisol stays high, the entire body changes. Cortisol increases gluconeogenesis, raising blood glucose levels. That's why patients often develop hyperglycemia or steroid-induced diabetes. It also breaks down protein, leading to muscle wasting, thin skin, and poor wound healing. Fat redistributes to the trunk and face, causing central obesity, moon face, and buffalo hump. At the same time, cortisol promotes sodium and water retention while increasing potassium loss, resulting in hypertension and hypokalemia. The immune system becomes suppressed. Patients bruise easily, heal slowly, and are at higher risk for infection. Key labs to assess include elevated serum cortisol, elevated 24-hour urine-free cortisol, abnormal dexamethasone suppression test, elevated ACTH if pituitary-related, hyperglycemia, low potassium, high sodium. Common signs and symptoms include muscle weakness, purple striae, mood changes, central weight gain, hypertension, and fragile skin. Treatment depends on the cause. If related to steroid therapy, steroids must be tapered slowly to prevent adrenal crisis. If tumor-related, surgical removal may be necessary. Medications such as ketoconazole or meteropone may reduce cortisol production. Patients may also require antihypertensives, insulin, or potassium supplementation. Nursing priorities include monitoring blood glucose and blood pressure, assessing for infection, protecting fragile skin, monitoring electrolytes, and supporting emotional health. Patient education is essential. Never stop steroids abruptly. Monitor blood glucose regularly. Report signs of infection, severe weakness, dizziness, or hypotension immediately. Cushing's is not just a cosmetic change. It's a systemic endocrine imbalance that affects metabolism, cardiovascular stability, and immune function. Now test your knowledge. A patient with Cushing's syndrome is most at risk for which complication? A. Hyperkalemia. B. Hypotension. C. Infection. D. Weight loss. Comment your answer below and follow for more nursing breakdowns.